And what about movement? Because, and I, not being a physical therapist, I just know that, I've always told people for a lot of reasons, for bowel movements and for all kind, walking is so important. And I wanted to practice what I preach when I had my C-section. And it was, I'm going to get up and walk as soon as possible. And I'm going to do this. And I had horrible pain, so it was really hard for me.
Yeah.
But there's this argument that I see people say, we know we need to walk, but is there kind of a minimum amount that's enough? Or can we be moving too much where we're actually causing harm? How do we find that middle ground when it comes to walking and movement after surgery?
Yeah. Great question. So within the first day or two, nursing generally gets you up to get you walking, things like that. So if you can get up, level surfaces, just walking 2 minutes, something like that to start is a really good start. Then you're honestly just slowly building up from there, up to 3, 5, that type of thing. So getting up and just moving your body, because you don't want to just stay sedentary for the reasons that we
blood clots, all everything else too, right?
Yeah. All the things. Yeah. Exactly. That mobility affects our whole entire systems, our body, everything. And so we want moms to get up moving and then just gradually increasing those walking distances and times and things like that. So like 3 minutes, 5 minutes, work up to 8, that type of thing. So just a gradual, just so you're not overdoing. You don't want to go from 5 to 30. Because then, what was the point that was too much? Then, so just gradually especially if the weather's nice, get outside if you can. That was what I did. I remember I told my mom, I was like, I can't be in this house another second.
Yes.
You baby, we're out of here. Yeah. And honestly, that early mobility for me was pivotal. And this was me, even as a PT, not really knowing a whole lot that I needed to, but that really helped. I was able to lay down in my bed. I never slept in the recliner personally. Again, that let me know, okay, that early mobility was really helpful. It's sometimes the simplest things in those first few weeks, because we think the word exercise, we think going back to the gym. There's so much more exercise that can happen, that can be safely introduced, that can really help with the mobility, help reduce the constipation, the C-section pass that is absolutely terrible that so many moms deal with. Like that mobility and getting up helps in so many different ways.
And to like how you mentioned, it was like, it felt like an accomplishment. I remember my little walks. I lived in Brooklyn when I had my first. Just walking to the end of the street, it gave me this confidence of, oh my gosh, I did it, because it's like rebuilding this confidence back in yourself that is so huge. And if you are an athlete or you do enjoy movement prior to delivery, it's hard not to have that in your life. Mentally, for me, it was like, same thing. I was like, get me out of this apartment.
For your mental health, for all the things.
Oh,
honestly.
yes. Yeah.
So basically, as long as we're starting with shorter increments of time and staying on the flat surface, we can feel like we're not going to be doing damage, I guess, that this is positive.
It's a positive thing.
And it's just a positive thing. As much as you can do, flat surface, gradually increase the amount of time that you're walking for is all good for recovery. Yeah.
It honestly, a lot of recovery is so basic, but there, again, like you said, there's so much fear because we just don't know. The recovery can be so much easier just by introducing the basics: breathing, mobility, safe transfers, learning how to not hold your breath when you're lifting the baby. Like, it's so much. And so that's why I created the guide to go through all those things, because it is the little bitty things. There are several things to learn, but it is the most simplest things that you can do, like breathe out when you lift instead of holding your breath, because that pressure, that internal pressure, can cause stress on the healing incision, the open abdominals. Like something simple, breathe out when you lift. Like it caused that just saves so much trouble. Wear your abdominal binder. It's just so many little bitty things that can just, help out so much.
That is our motto as well. It's like,
if
things aren't
breathing.
simple, then people aren't going to do them. We
absolutely.
have to
Moms don't have time for complexities.
No, and no, not at all. And just to have that little tool in your belt to be like, okay, the breathing element of it, like all I have to do is shift this one thing, and I'm helping myself in my recovery.
Exactly.
We have to talk about the binder, because I loved my binder, and I'm always when people are like, nobody ever introduced a binder to me. No one even talked to me about it. I'm like, what? Because mentally, it was such a huge component to my movement, was knowing that I had some additional core support, since I'd obviously lost that during the surgery and in the pregnancy. So talk to us about what your feelings are about a binder, because I'm a binder gal.
She's a binder gal. I tried it and I felt like it didn't fit properly. So I really want to know from you when to start it, how often to wear it. I mean, do we wear it to sleep? Do we wear it all day for a few hours? And how to find one that feels like fits properly, that's doing what it needs to do,
Yes.
but isn't uncomfortable. Sorry, that was a lot. Go ahead.
No, all good. So number one, I am definitely a fan of the binder for all the reasons that you just stated, especially between that 0 to 8 week window. So many things are changing. Your core is still very weak. The uterus is shrinking. Your belly's changing in reference to where things are. Organs are shifting. Like there's just so much happening there. And so to have that level of protection helps moms, again, help you reduce risk of dehiscence or, any type of rupturing. So many moms go back to the doctor. I had a friend who had a C-section before me, and she told me how she had an infection. And I was just like so freaked out about having this C-section. I'm just like, how do you prevent that? And so one way is to wear the abdominal binder and wear it correctly, because even improper wear, just putting pressure or rubbing or anything on that incision, that can cause increased risk of infection and also increased risk of pelvic floor issues if worn too tightly or not in the right way. And so you want to make sure when you do place that abdominal binder on that it is actually covering the C-section. So if you have one that feels uncomfortable, then that's probably not the right one. If it feels too tight, it probably is. You want to be able to take a full deep breath in and out and not feel like, okay, the binder's keeping me from breathing. You should be able to breathe naturally, good rib mobility, the whole nine. And so that's a good indication that, okay, this is good. And then the more simple the binder is, the better in my book. I don't care what brand it is. I don't care, if it has flowers or what's going on, as long as it's protecting and it's easy for you to put on and off and it fits your body frame, because everybody's body frame is so different. So to say this brand and then people like, I hated that one. It did this and that, right? Because everybody's body's different. So just finding one where you can breathe well, when you wear it, it's not too tight and you can wear it correctly. That's a good one.
Should it go up a certain height on your belly?
It does rest like right under the rib cage area. It doesn't need to be super high because the area that you're protecting is your core. And so your core is going to be right under the rib cage all the way down to the pelvis. And so we want to protect that whole entire area. So that's where you want to make sure that's the placement is.
So it's fair to say it's a binder. It's not a corset.
That's all right.
Yeah. Because I do think that some women
yes,
utilize it.
Trainers. We're not putting a trainer waist. We're not trying to get a fupas. That's not even the concern. There's so many other things for us to be concerned about other than snapping back, right? And so it shouldn't fit like a corset. It shouldn't fit like a waist trainer. It should be breathable. It should just feel like it's supporting your belly. And the best times to wear it is when you are doing, you're going to be doing any lifting. So meaning of the baby, things like that. So that way you feel protected. If you're going to go on a walk and you feel like, I just feel like my insides are hanging out, like I don't want to walk because of that, then that's a great time to wear it. And so really just listening to our bodies will often tell us like, I need more support here when we're doing this specific activity. So wear it then. So most times during sleep, we do not, right? And so sleeping is just going to be uncomfortable. Then you're more than likely just lying there. You're just, and then if you're sitting in the recliner, definitely don't do that, because then it's just,
it's going to rub, right? Yeah.
Right. It's mostly with activity based. And what we want to optimally do is teach moms how to use their own personal corset, meaning their deep core muscles, because those muscles run front to back, just like the corset does. And so the earlier that we can teach moms how to do those exercises, then we can wean off of that corset. You won't feel like you need it so much because, okay, now I'm reconnecting to those muscles versus they're just kind of hanging out and not really, they're going to be used, right? Because they're there, but they're not being activated. You don't have an awareness of them. And so the more you have that awareness, you start to reconnect with them, you start to strengthen them, you'll feel more supported because those muscles are there all the time, 24/7. And so that's the best corset you could ever wear. But typically, if you can start those exercises in the first 2 weeks, you can start to wean off that even in sooner. But 0 to 8 weeks is a good time frame. That's okay. You don't want to be wearing it and relying on it long after that. It's not doing a whole lot after that point, but everybody's situation is different, right? Because some people have to go back to the hospital. Some people have to have surgery again. Everybody's body's different. So again, listen to your body, but that's kind of that window, that's best time frame to wear it.
Such good advice, because I think that a lot of what I do love about social media now is people are actually showing that you have a belly for a long period of time. And, 5 years ago, when my youngest that wasn't something everyone was throwing out on Instagram. It was only like the perfect photos. And there's something about the messiness that has come out of social media that honestly is so comforting. I mean, it's more real, and it's more, and this is going to help people with their recovery to not feel this pressure of bouncing back so fast. You will set yourself back more if you try to rush it. And personally, that's what I did, which is why I think I ended up with a very large diastasis and ended up going in for surgery to have it repaired, because mine was like almost a little over 4 inches. And I went to various doctors, and some were like, no, you just get a little tummy tuck, you'll be fine. And others were like, no, this is something more. This is structurally, you need to be repaired in a much different way. But honestly, I kind of blame it on like just trying to jump back in too fast and not giving my body that time to truly heal the right way, because I didn't know.
Well, let's talk about that, because I know you have quite a bit of knowledge with diastasis. And so what is the connection between diastasis recti and C-sections? Is there a greater risk with C-sections versus vaginal delivery?
Absolutely. 100%. And so
I never thought about it before. I heard you say that on something, and I was like, that never crossed my mind. But it makes sense, right?
Yeah. C-section mom's going to have the highest risk, because so if you think about it, vaginally, if you have the baby, no actual tissues cut. Yes, it's thinned. Yes, it's, the muscles are widened. That's all natural in pregnancy. But when you have the cesarean, they go in and they actually cut the linea out the tissue. That tissue is what holds those two rectus abdominis muscles together. And so the risk is going to be greater, period, because that tissue is actually cut versus thinned. And so, yes, it does scar, right? And some surgeons, from what I've understood, like some OBs, if that tissue is viable, they can actually see it and they can go back in and stitch. Some will. There's not much research still saying whether that is helpful or not. But it seems like it should sound good, right? Like, they stitched me back together, but moms still do have issues.
Do you mean during a subsequent C-section or different type of surgery to fix
right? So during the actual cesarean.
Right.
Exactly. Yeah. So from what I understand, like most will just let it scar on its own, but I've heard where some OBs and surgeons, they will go in and they'll stitch it. Sometimes people will have a general surgeon in the room, a plastic surgeon in the room, as well as their OB. I've heard of cases of people doing that as well. And that's more people that have knowledge and know to do that. That's not the average case. Let's put that out.
And I don't think I don't think we know. I mean, I'm not a surgeon. I always have to clarify, but I don't think we know how many of these things are really effective, because you're still you're so newly pregnant, all of the tissues. And when you're trying to fix something, at that moment in time, it sounds so wonderful. People say, just get my tummy tuck and C-section at the same time. Like, that's
definitely not possible.
Not a reality. But what I think they're referring to...
No full tummy tuck, definitely not.
Yeah, but what I think what they're referring to is what you're saying, is where they're gonna go in and try to make that better. But it still has to heal, right?
It still has to heal.
And what about also the connection between, let's talk about the C-section shelf a little bit. So we've talked a little bit about preventing that already, which is amazing. But there is also a connection with the shelf and the separation with the diastasis. Can you explain that a little bit? Because I thought that was interesting too.
So because the muscles are separated, what they're going to do is they're going to protrude out. And so if there is any type of lack of mobility around the incision, which is going to be, period, right? That's going to happen. But the amount of which there is tightness, the more tight it is, the more it's going to come in and be stuck. And then anything above that is going to basically kind of hang over.
So the looser it is above and then the tighter it is below, when you combine the two,
it's going to be a shelf.
You get that shelf.
Exactly right. And so if those abdominal muscles are separated, they are weakened. And so you want to address the abdominal separation. You want to address anything that's basically causing that shelf to form. So that could be excess fluid or entrapped fluid around the incision. That could be above and below. So you can have like that puckering even below the incision. Yes. It could be from excess fatty deposits in the area, or any excess fat or any excess skin. So if you have a lot of skin from stretching, then of course that's going to hang over. And so you want to get to the root issue of the whole thing, which is the lack of mobility from the scar tissue adhesions attaching itself to nearby fascia and things like that. You want to get in there and start that scar mobilization, both indirectly as soon as possible and then directly. And when I say indirectly, meaning you don't want to physically go in and start massaging your scar from day one, because all of those things are healing. But the things that we talk about, like lying flat, that's mobility. Getting up and moving, that's mobility. So there are so many ways to start tackling that scar tissue from adhesing to nearby tissues to cause that shelf formation that you can do in the early stages. And then once you're able to be cleared, your incision's healing well, you can start the scar massage typically around 6 weeks to be on the safe side, just above and below, and then directly on the scar, maybe around the 8-week mark, starting to massage that area to get that area moving so that it's not so stuck. Then it wouldn't protrude out as much. But you also want to address the diastasis recti that, again, most moms are going to have, even if you didn't have a C-section, but definitely more so because of the C-section. You want to be doing that core rehabilitation exercises to strengthen those deep core muscles so that they can bring those muscles back in, because that's what they do. They draw the muscles in, and that's going to help reduce that protruding that happens with the C-section shelf.
Oh, that's like
It's so
gold
much.
for everyone, because
Such gold.
I had it and I just spent so many hours staring in the mirror and I'm like, will this just go away? I don't think this is going to go away, and
Yeah.
it's a hard
So then moms just start working out like the traditional exercises.
Exactly.
They're going to do what they know. Right. And so unfortunately, we're not educated about our bodies enough. We're not educated about, I never heard of deep core muscles. Okay. Yes, I learned it. I did cadavers and the whole nine. But I mean, from a standpoint of beauty or my tummy, it was just like, 6-packs. Everybody wants 6-packs. Nobody's learning about the deep core and the connection to the pelvic.
You grew up
core
with
and
Britney Spears.
Right.
Exactly. So it's just like, you're going to do what you know. And the mainstream then was just having flat abs. Nobody knew that you need to strengthen these muscles.
But it's good to know, because I think that someone they might look at their scar, they know they have a shelf. I'm thinking about my friend in particular who she's thin. I don't think she worries about like the separation of the abs, and but she has this shelf, even though she's thin, and it's driving her crazy. It's something someone might not think is, maybe you do have some of that separation in the abs. And even though that's not what's bothering you, if you work on that, that may also help the appearance of that shelf.
And thank you for mentioning that. That made me also think. So other things like posture. So if you stand with the anterior pelvic tilt, that's going to also cause the whole area to protrude. And so it could be from posture. It could be from a lack of mobility of other muscles and fascia around the area that's causing you to stand in the end. It's like so many things connected. And so for moms to try to figure this out all by themselves, they will be vastly frustrated. And not that there's anything wrong with surgery, but a lot of times that'll be the go-to thing to do, not realizing, it's because I grip my abs. If you grip your upper abs, what that does is that causes that pooch down below. So some moms are like, I'm so fit, like in the top of my abs, like I'm so flat up here, but then I have this pooch down here. And that's a lot of times because moms do exercises that are focusing heavy on the external abs. And then also how they recruit muscles. They're recruiting from the top and not from the bottom. So those muscles are just staying weak down there. And that's very common for those lower abs to feel super weak after a C-section, because they've been, the area's been cut. The lack of sensation there, just is a lack of connection to those muscles. A lot of times that does happen where there's so many other things going on in the picture where you may not be able to figure that out by yourself. So to have an assessment by a PT that has a really good understanding of C-sections and diastasis recti,
Yes, you are the expert.
It's really helpful, because there's so many different components and things that's happening there that you're just like, if I just do lower ab exercises, this should go away. Not always the case. It could be your posture. It could be how you're recruiting the muscles. And so sometimes we're missing that piece that can really make a really big difference in the recovery.
Thank you for clarifying that. I think that's really important, because I think it's like you're harder on yourself. Like, if I exercise just a little bit more, but.
Exactly. Or diet more. People will diet themselves to death, not realizing it's the muscles. Yes. You can't diet those muscles.
And those inner kind of muscles. Like, it's even hard for me to understand, okay, what muscles are the ab muscles versus that inner pelvic core those are two different things that you have to kind of work in different ways.
Right, work in different ways, exactly. There's going to be different exercises that recruit those muscles in a different way. The typical traditional exercises like crunches, planks, which is why so many people say don't do them, is because they recruit the rectus abdominis muscle more than the deep core. But if you learn how to recruit the deep core along with those muscles, then those exercises are not so bad. I'm sure if you follow my page enough, you've probably seen that.
Yeah, no, but say it again. Say it over and over again.
Yeah.
Exactly. So there's no thing that you don't do, but some people, they can't do the plank without falling into an anterior pelvic tilt and not being able to recruit their muscles. And so we just say, okay, there's better exercises that you can do before we get to this point. But it is a great exercise to recruit those muscles because you need them, because those rectus abdominis muscles, that's what actually reduces the width of the diastasis. So you have the width and the depth. Some people will feel like, well, I can just fit 1 or 2 fingers there. But then if they sink those fingers in, it's like, oh, it's actually kind of deep.
Yes. Yeah.
That's where those deep core muscles come in to help with that depth.
How does one know if they have too much of a separation? So most of us, if we've had a child or been pregnant maybe more than once, we probably have a little bit of this, right?
Right. Yeah. 1 to 2 fingers is a norm.
Okay.
Yeah. Yeah.
And then what about if you pushed it in? How deep should it be?
Yeah.
Like
so no deeper than like nail
nail.
bed depth. Yeah.
Okay.
Like nail bed. That you want it to feel firm in there. If it feels like I'm just kind of going into a void, that's a sign that, okay, especially if you had a C-section around that area where that tissue is cut, you want to check, from the belly button down. Sometimes you'll check above and it's like, oh, it's tight up there. But down there, oh, wow, I don't feel much. I don't feel much happening there. And so that can be the case for a lot of moms, especially C-section.
Well, we could talk to you forever, and I know
have
Jen.
one more question.
Okay, Jen has one more question.
Sorry, this is a random one too, but I have to ask it because this was a question from someone on Instagram asked us, and I'm gonna add on to it a little bit. But she asked about because it's about the scar. She asked about how to handle ingrown hairs in the incision, and I had this problem as well that I have not thought about in 6 or 7 years. But what I thought was interesting about this question is, have you seen a difference in healing depending on where the incision is? Meaning, have you noticed that some people have very low incisions below the pubic hair line and some are kind of much higher?
Yeah.
I'm just wondering when you've worked with people, if you've noticed a difference in how they heal or with the shelf or without the shelf, depending on that.
Where it is.
Yeah.
Yeah, sure. Of course, if anything really closer to the pelvic bone, there's going to be less fat there, right? It's going to be less all the
Less
things.
shelf. Because I don't have a shelf. I think because it's really low, it's less likely, right?
It's really, really low. Yeah, some people do it really, really low. And so I'm not a surgeon, so I'm not really sure the thought process behind that, the research behind that. But some moms do love that it is lower. They can wear their bikini, it's not be aesthetics and things like that. In reference to healing, I've not seen that much of a difference in regards to, other than like what you said, like hair, because the lower down you go, the more you're in the pelvic region and there's going to be more hair. There's going to be more cause of ingrown hairs and things like that. I'm not the expert in regards to the hairs.
I figured you weren't, but it brought up just...
You'll be surprised. Just like some people just think of like dermatologists, they think of acne on skin. Like people think of PTs and they think, you're going to help me walk again, right? And so there's so much that dermatologists know and can help with in regards to that. So anything with the skin, seek the dermatologist, because you never know what little things that they have that can help with that. That would be my advice in regards to that. I can't imagine or think of someone else. Esthetician, possibly, but I don't know if that's their area.
Plastic surgeon.
Don't get me wrong on that.
Yeah, but no, dermatologist is perfect. And I think, to that person suffering, it does go away for whatever reason. It just can take longer to heal. And I've also heard things that it might be more painful. And I'm sure my OB did it for me to be aesthetically pleasing, but I'm always looking for excuses as for why it was so painful for me, and it's not just me. But anyway,
so you felt like it was more painful having it lower down.
I've seen that. It might be, and like that would be one of the downsides. And it's also could be technically difficult, potentially, depending on the size of the baby and your human body and et cetera. But I just know that they're different, so I wanted to bring that one up. Are we done with our questions?
I'm so glad you wrapped it up with pubic hair, Jen.
Like, I need to get this question answered.
Yeah, she really wanted to ask that one. Well, we love what you're doing because, I mean, it's so funny when we start our podcast, everyone's like, you guys are being so niche. Like, does this really make sense? And it does make sense. It makes so much sense for us to be being niche and being really thinking about the healing process for a woman from start to finish. And what you're doing is so wonderful. Thank you for taking your experience and becoming an expert and providing these guides and these resources
For
that
C-section
honestly-
moms.
For C-section moms that this is not a
Absolutely.
luxury. This is actually what should be
Very necessary.
very necessary. Always.
Get back to life, to get back to running, lifting and playing with your kids. I mean, the reasons go on and on why rehab is so important. Yes, aesthetically, there's so much that we want, but functionally, there's so many things and issues that moms and women after cesarean birth deal with, because we haven't even, I feel like we haven't touched on half the things.
No.
Like pelvic floor issues, like having pelvic floor issues and have a cesarean. Yes,
Yes.
that is a thing.
That
It
is a
is
thing.
normal, not normal, excuse me,
The
it's a
myth.
thing to have
Yes.
painful sex and to have pelvic floor issues, even though you had an abdominal birth. And so there's just so much that we can learn about this, that moms can learn. So thank you all for doing the work that you're doing to educate moms more so that they can better advocate for themselves, take care of themselves, because this is not something you should have to figure out on your own, and know that you don't have to. Like this guide that I created it to get it into the hands of as many moms as possible. And it's helped so many moms prepare, recover, all of the things, all the way up to 1+ years postpartum, going back to exercise, swimming, hiking, all of the things. And I don't think we really got to touch on the rehab protocol that I created, but I did want to touch on that as well. If there's any professionals listening to this, doulas, midwives, anyone that's working with C-section moms, we created a protocol specifically for professionals who are wanting to help moms, even if you're seeing them in the later stages, but you want to be able to educate them on how important mobility is. And then even the acute care PTs or anywhere in the acute care space where you see these moms earlier, going over mobility, like the time frames of when you can start the mobility, when you can start the exercise. That resource we made completely free to get that into the hospitals and the hands of the birth and medical professionals to be able to help moms as much as possible. So that resource is available. I think you all will share show notes.
well.
Of course.
Yes.
Yes.
Know that those resources do exist. We're doing our best that we can to help as many C-section moms. So again, thank you for the work that you're doing. And if anybody wants to connect with me on social media, ask questions, like I am here for all of those things. And so I have a membership. I have all the
Tell us briefly what you have a lot of offerings.
I tried my best to create it.
Yeah, I mean, you have a lot of offerings that I know if I were to ever have a C-section again, I'd be signing up for all of them. But can you? No, I'm so jealous that I didn't. All these things that you're doing that you have available. I just know how much they would have helped me, and so I thank you so much for creating them. Tell us where everyone can find you, and we'll of course have everything in the show notes. And
Sure. So social media, people find me on Instagram mostly. I have all the other things. I'm not the best. I'm too busy running after kids, to be on all the things. But I try to share as much education, information on social media, on Instagram for PT Trainer Shonda. And then all my resources, for the most part, you can find the link in my bio, things like that. And then my website, coreelevationfitness.com. That's where you can find I started a new monthly membership that actually houses all of my programs. I have a post-abdominal surgery program. So that one's also for any abdominal surgeries, hysterectomy, myomectomy, C-section, tummy tuck, diastasis repair, hernia repair, any of those things.
Bethany,
I have a whole
awesome.
rehab program to help moms recover from that. So you can find all of those things on my website. And I made it for a super low cost, $29 a month for pretty much everything that I put out there into this world, just so I can help as many moms as possible, because I don't want cost to be a thing that keeps moms from this information. Hence the free rehab protocol, the free C-section must-have list, just of things that you should have if you're going to have a C-section. Like I try to put as many resources out there to help moms get as much education as they can to prepare
awesome.
the best they can.
Thank you so very much.
So much.
I always like to wrap it up by giving back to you, because you've just provided our audience and ourselves with so much knowledge and useful tips. So thank you for that. So I made a mantra for you.
Okay.
If you're open for it, you can keep your eyes open. You can
Love it.
close your eyes
Okay.
and just be comfortable and repeat after me. I honor the strength in every scar.
I honor the strength in every scar.
I walk beside each mother as she rises.
I walk beside each mother as she rises.
I am empowering mamas to heal physically and emotionally.
I empower mamas to heal physically and emotionally.
I honor myself as a gift.
I honor myself as a gift.
You are a
Aw.
gift to C-section mamas.
Yes.
Thank you so
You're gonna make me teary-eyed.
This is the doula side of me
Welcome to
coming
the
out.
C-section Experience podcast.
The big hugs holistic.
Big hugs away.
I'm glad I got to get one of those hugs virtually. Thank you. Oh,
You're
God, that's
welcome.
awesome. Thank you so
All
much.
right,
Thank you
thank
for
you
pouring back
so
into me
much.
also.
Yes.
All right.
Okay.
See y'all
Thank
next week.
you.
Bye.
Bye.
Bye.